So homosexual development. Essentially, there are lots of models. I'm going to discuss the model devised by Troyden in 1987. Essentially, he goes through 4 stages, which a lot of them do, and it begins with sensitization, identity confusion, identity assumption, and commitment. I think the important thing to remember about this model that I'm using is that it essentially was devised asking adult homosexuals. So they had to rely on their memory. And you as adults understand that you don't always remember things very well. So given that in perspective, that you're applying something that was done on adults to children or to adolescents, and 2, that you have to consider that things don't always go in order. So nothing's set in stone, and things may go in a different order. And you always have to consider the developmental age of your adolescent. So you can get a 13 to 14-year-old who acts more like a 17-year-old, and sometimes you can get a 17-year-old who acts more like a 14-year-old. And it's really important to put all these things in perspective while you're talking about it. Having said that, sensitization usually begins in childhood. Some people actually recollect feelings of being different at about age 5. It involves feelings of marginality and perceptions of being different around same-sex peers. Going on to identity confusion, they go in order, again, just to remind you, that usually what happens, it begins middle to late adolescence. And if I were to remind you, if you don't remember your own adolescence, this is usually about ages 14 to 17. This is a time when you feel like you can do everything and you can drive with no seatbelt on after you've had a couple of beers. There's an absolute feeling of omnipotence and that nothing can happen to you. Complicate that with feelings of not being confident, and you can sometimes get in a very difficult situation, as we'll bring up later. So really this time is going to involve feelings that they might be a homosexual. And when you're thinking that way, it can really complicate some of the high-risk taking behavior that you do. Really particular about identity confusion is that you go through some process in that, and that begins with denial. You don't believe you're a homosexual. You don't believe you're a member of the sexual minority community. You try and repair it by essentially trying to get rid of those feelings. Things that might happen are you might start to feel like you can act like super heterosexual. So these are the kids that are probably more promiscuous, higher rates of pregnancy, higher rates of STDs, because they're really trying to prove to you that they're really heterosexual and they don't want to associate with being a homosexual. They'll be the first ones to start teasing, to beat somebody up because they so deny those feelings. And then essentially they want to just be like everybody else. So there are going to be constant attempts to not make themselves feel so different. Going back again, because if you remember, the stages were sensitization, identity confusion, and then identity assumption. So identity assumption begins usually in late adolescence, and that's usually after the age of like 18 to 21 if you're to do the high-end range of pediatrics. And essentially at this point, you're establishing a homosexual identity, and you're sharing that identity with others or coming out, another definition you can find on your handout. But at this point, if that all goes well, you can transition to commitment, which is usually when you're leaving the household and you're adopting a homosexual way of life. Here's the thing. We're finding that this is occurring at earlier ages. So when you consider somebody's developmental readiness to take on the challenge of being different and having to be confident to do that in an environment that may not be supportive of who you are and may not mirror who you are. This is getting harder and harder to do when you're 14 and when you're 15 versus when you're 17 and 18. And I just want you to keep that in the back of your head as we ask questions later of our sexual minority group. Before I ever talk about healthcare issues in my practice, essentially, I always